Anal fissures are small tears in the lining of the anus, often causing pain and bleeding during bowel movements. They are a common condition affecting people of all ages, but especially adults. Understanding how to properly diagnose and evaluate anal fissures is crucial for effective treatment and relief. In this video, we will explore the most commonly used tests and examinations that healthcare professionals rely on to assess anal fissures, ensuring accurate diagnosis and guiding the best course of management. Let's begin by understanding why proper evaluation is so important. Patients with anal fissures typically present with symptoms such as sharp pain during or after bowel movements, visible blood on toilet paper, and sometimes itching or irritation around the anus. These symptoms are often the first indicators that prompt individuals to seek medical attention. Recognizing these signs early can lead to timely evaluation and treatment, preventing complications and chronic discomfort. Next, let's look at the initial steps a doctor takes when a patient presents with these symptoms. The first step in evaluating an anal fissure is taking a thorough patient history. The healthcare provider will ask about the onset, duration, and severity of symptoms, as well as any previous episodes or related conditions such as constipation or diarrhea. They may also inquire about lifestyle factors, diet, and any history of trauma or surgery in the anal area. This information helps to differentiate anal fissures from other anorectal conditions and guides the next steps in the diagnostic process. After gathering the patient's history, the next step is a physical examination. This is a crucial part of the evaluation, as it allows the healthcare provider to directly observe the anal area for signs of a fissure. The examination is typically performed with the patient in a comfortable position, such as lying on their side with knees drawn up. The doctor will gently separate the buttocks to inspect the anus for visible tears, inflammation, or other abnormalities. Visual inspection is often sufficient to diagnose a typical anal fissure. The healthcare provider looks for a linear tear, usually located in the posterior midline of the anus. Acute fissures appear as fresh tears, while chronic fissures may show raised edges or a sentinel pile, which is a small skin tag. This simple, non-invasive test is quick and effective for most cases, allowing for immediate diagnosis and treatment planning. A digital rectal examination, or DRE, may be performed to assess the tone of the anal sphincter and check for other abnormalities. However, in cases of acute anal fissure, this test is often avoided due to the significant pain it can cause. If performed, the doctor gently inserts a lubricated, gloved finger into the anal canal to feel for any masses, irregularities, or signs of infection. The DRE is more commonly used in chronic or atypical cases where further assessment is necessary. Anoscopy is a simple procedure that allows direct visualization of the anal canal and lower rectum using a small, tubular instrument called an anoscope. This test is particularly useful for identifying fissures that are not easily seen during visual inspection, as well as for ruling out other conditions such as hemorrhoids or tumors. Anoscopy is usually quick and can be performed in the doctor's office with minimal discomfort. During anoscopy, the patient is positioned comfortably, and a lubricated anoscope is gently inserted into the anal canal. The doctor then examines the lining for fissures, inflammation, or other abnormalities. The procedure is brief and generally well tolerated, though some patients may experience mild discomfort. Anoscopy provides a clear view of the anal canal, making it a valuable tool for accurate diagnosis. Proctoscopy is another diagnostic test that examines the rectum and lower part of the colon. It uses a slightly longer instrument than the anoscope, called a proctoscope. While not always necessary for typical anal fissures, proctoscopy may be recommended if the doctor suspects other underlying conditions or if the fissure does not heal with standard treatment. This test helps to rule out more serious issues, such as tumors or inflammatory bowel disease. Flexible sigmoidoscopy is a more advanced test that allows the doctor to examine the rectum and the lower part of the colon using a flexible, lighted tube. This test is not routinely used for simple anal fissures, but may be indicated if there are atypical symptoms, persistent bleeding, or suspicion of other diseases. Flexible sigmoidoscopy provides a broader view of the lower digestive tract, helping to identify or rule out additional problems. Colonoscopy is a comprehensive test that examines the entire colon and rectum. It is rarely required for typical anal fissures, but may be necessary if there are warning signs such as unexplained weight loss, family history of colorectal cancer, or persistent symptoms despite treatment. Colonoscopy helps to exclude serious conditions like colorectal cancer or inflammatory bowel disease, ensuring that no underlying issues are missed. Laboratory tests are not routinely required for the diagnosis of anal fissures. However, if there is suspicion of infection, inflammatory bowel disease, or other systemic conditions, blood tests, and stool studies may be ordered. These tests can help identify underlying causes or complications, such as anemia from chronic blood loss or markers of inflammation. Laboratory evaluation is tailored to the individual patient's symptoms and risk factors. Imaging studies, such as pelvic MRI or endoanal ultrasound, are rarely needed for typical anal fissures. These advanced tests may be considered in complex or recurrent cases, or when there is suspicion of deeper tissue involvement, abscess, or fistula. Imaging provides detailed information about the anal sphincter and surrounding structures, helping to guide further management in challenging cases. One of the key goals of evaluating an anal fissure is to differentiate it from other anorectal conditions, such as hemorrhoids, abscesses, fistulas, or even malignancies. Careful examination and the appropriate use of diagnostic tests help ensure that the correct diagnosis is made. This prevents unnecessary treatments and allows for targeted therapy, improving patient outcomes and comfort. Distinguishing between acute and chronic anal fissures is important for guiding treatment. Acute fissures are recent, with fresh tears and minimal surrounding changes. Chronic fissures, on the other hand, may have raised edges, a sentinel pile, or exposed muscle fibers. The duration and appearance of the fissure help the doctor decide on the most appropriate management strategy. Assessing the severity and nature of pain is a key part of the evaluation. Patients are often asked to describe their pain, its timing, and any factors that worsen or relieve it. This information helps to confirm the diagnosis and rule out other causes of anal pain, such as infection or abscess. Pain assessment also guides the choice of pain management strategies during treatment. Bleeding is a common symptom of anal fissures, usually presenting as bright red blood on toilet paper or in the stool. The doctor will assess the amount, frequency, and duration of bleeding to ensure it is consistent with a fissure and not another condition like hemorrhoids or colorectal cancer. Persistent or heavy bleeding may require further investigation with endoscopic tests. Understanding a patient's bowel habits is essential in evaluating anal fissures. The doctor will ask about the frequency, consistency, and ease of bowel movements, as constipation and hard stools are common contributing factors. Addressing these underlying issues is often a key part of both diagnosis and treatment, helping to prevent recurrence. During the physical examination, the doctor will look for signs of infection, such as redness, swelling, discharge, or fever. Infected fissures may require additional treatment, including antibiotics or surgical intervention. Prompt identification and management of infection are important to prevent complications and promote healing. In some cases, an anal fissure may be associated with a fistula or abscess. The doctor will carefully examine the area for any abnormal openings, drainage, or swelling that could indicate these complications. If a fistula or abscess is suspected, further imaging or surgical evaluation may be necessary to plan appropriate treatment. Evaluating the tone of the anal sphincter is important, especially in chronic or recurrent fissures. Increased sphincter tone can contribute to poor healing and persistent symptoms. The doctor may assess this manually during examination or, in some cases, use specialized tests, such as anal manometry, to measure sphincter pressure. Anal manometry is a specialized test that measures the pressure and function of the anal sphincter muscles. It is not routinely used for all patients with anal fissures, but may be indicated in complex or recurrent cases. The test involves inserting a small, flexible tube into the anal canal to record pressure readings. Anal manometry helps to identify underlying functional problems that may be contributing to the fissure. Endoanal ultrasound is an imaging test that uses sound waves to create detailed images of the anal sphincter and surrounding tissues. This test is rarely needed for simple fissures, but can be valuable in cases where there is suspicion of deeper tissue involvement, abscess, or fistula. Endoanal ultrasound provides precise anatomical information to guide further treatment. Pelvic MRI is an advanced imaging test that provides high-resolution images of the pelvic region, including the anal canal and surrounding structures. It is reserved for complicated or recurrent cases where other tests have not provided enough information. MRI can help identify hidden abscesses, fistulas, or other structural abnormalities that may be affecting healing. In rare cases where the appearance of the fissure is unusual or there is suspicion of malignancy, a biopsy may be performed. This involves taking a small tissue sample from the affected area for laboratory analysis. Biopsy helps to rule out cancer or other serious diseases, ensuring that the correct diagnosis is made and appropriate treatment is provided. Sometimes, anal fissures are a sign of underlying diseases, such as Crohn's disease, tuberculosis, or sexually transmitted infections. The doctor may order additional tests or refer the patient to a specialist if there are signs or risk factors for these conditions. Identifying and treating the underlying disease is essential for successful management of the fissure. In certain cases, especially in younger patients or those with risk factors, screening for sexually transmitted infections, STIs, may be recommended. Some STIs can cause symptoms similar to anal fissures or complicate healing. Testing and treating these infections is important for overall health and recovery. Patients with weakened immune systems, such as those with HIV or on immunosuppressive therapy, may require additional evaluation. Anal fissures in these individuals can be more severe or associated with unusual infections. The doctor may order specialized tests and coordinate care with other healthcare providers to ensure comprehensive management. Anal fissures are also common in children, often related to constipation and hard stools. The evaluation process is similar to that in adults, focusing on history, visual inspection, and gentle examination. In most cases, invasive tests are avoided unless there are unusual symptoms or failure to heal. Addressing bowel habits and diet is especially important in pediatric cases. Elderly patients may present with anal fissures due to age-related changes in bowel habits or underlying health conditions. The evaluation is similar to that in younger adults, but may require additional attention to comorbidities and medication use. Ensuring a gentle and thorough assessment helps to avoid discomfort and identify any complicating factors. Pregnant women are at increased risk for anal fissures due to hormonal changes and increased pressure on the pelvic floor. Evaluation focuses on history and visual inspection, with invasive tests avoided unless absolutely necessary. Management is tailored to ensure safety for both mother and baby, with a focus on relieving symptoms and preventing recurrence. Patients with chronic diseases such as diabetes or inflammatory bowel disease may have a higher risk of developing anal fissures and complications. The evaluation process may include additional laboratory tests or imaging to monitor for infection or poor healing. Coordinated care with specialists may be necessary for optimal management. Recurrent anal fissures may indicate an underlying problem, such as increased sphincter tone, chronic constipation, or another disease. The doctor may recommend more detailed evaluation, including imaging or manometry, to identify the cause and guide treatment. Addressing the root cause is key to preventing further recurrences. Most anal fissures occur in the posterior midline, but fissures in other locations may suggest underlying diseases, such as Crohn's disease, HIV, or malignancy. The doctor will carefully evaluate atypical fissures and may order additional tests or refer to a specialist for further assessment. The presence of multiple anal fissures is unusual and may be a sign of systemic disease or infection. The doctor will investigate possible causes, including inflammatory bowel disease, sexually transmitted infections, or immunodeficiency. Appropriate laboratory and imaging tests may be ordered to identify the underlying issue. Chronic anal fissures may be accompanied by a sentinel pile, which is a small skin tag at the edge of the fissure. The doctor will note the presence of skin tags during examination, as they can help differentiate chronic from acute fissures and may require removal if they cause discomfort. In chronic fissures, the base of the tear may reveal underlying muscle fibers. The doctor will look for this sign during examination, as it indicates a longer-standing problem and may affect treatment choices. Exposed muscle fibers are a hallmark of chronicity and may require more aggressive therapy. Anal fissures and hemorrhoids often coexist. The doctor will check for the presence of hemorrhoids during examination, as they can contribute to symptoms and may require concurrent treatment. Proper identification and management of both conditions are important for symptom relief and healing. Anal stenosis, or narrowing of the anal canal, can be a complication of chronic fissures or previous surgery. The doctor will assess for signs of stenosis during examination, as it can affect bowel movements and healing. Treatment may require specialized interventions to restore normal function. Enlarged anal papillae are sometimes seen in chronic fissures. These small, benign growths are found inside the anal canal and can be identified during examination. While usually harmless, they may contribute to discomfort or confusion with other conditions, so proper identification is important. Chronic fissures may cause changes in the surrounding skin, such as thickening, discoloration, or scarring. The doctor will look for these signs during examination, as they can indicate long-standing disease and may influence treatment decisions. Addressing skin changes is part of comprehensive care. Anal itching is a common symptom that may accompany fissures, especially in chronic cases. The doctor will ask about itching and examine the area for signs of irritation or secondary infection. Addressing itching is important for patient comfort and can help prevent further injury from scratching. Occasionally, anal fissures may be associated with discharge, particularly if there is infection or a fistula. The doctor will check for any abnormal fluid during examination and may order tests to identify the cause. Treating discharge is important for healing and preventing complications. In summary, the evaluation of anal fissures involves a combination of patient history, physical examination, and selective use of diagnostic tests. Most cases can be diagnosed with visual inspection and history alone, but additional tests may be needed for atypical, recurrent, or complicated cases. Proper evaluation ensures accurate diagnosis, effective treatment, and better outcomes for patients. Evaluating anal fissures requires a careful and systematic approach, starting with a detailed history and physical examination. Most fissures can be diagnosed without invasive tests, but additional investigations are available for complex or atypical cases. Early and accurate evaluation leads to better management, faster healing, and improved quality of life for patients. If you or someone you know is experiencing symptoms of an anal fissure, seeking timely medical attention is the first step toward relief and recovery.